since you brought up diagnostic criteria, how on earth do we make the diagnosis? We mentioned a blood test. What do the guidelines say in terms of how you work this up? What are you looking for? What is essential to make the diagnosis?
The classic CDC IDSA guidelines are to use something called a two-tiered system.
Okay.
The two-tiered system involves a screening test called ELISA, and if that ELISA test is positive, it is followed by a confirmatory Western blot test. They're just two different types of technology. One's more sensitive, the other's more specific. In the setting of HIV, whereby the ELISA test is 99.9% sensitive, the Western blot is in the order of 98+% specific. In the setting of Lyme disease, it's about 50%.
Which is 50%?
The two-tiered system cumulatively is about 50% sensitive across the board.
So you're basically telling me that the blood test ain't so good.
Correct. And the statements that in late neurologic neuroborreliosis it's highly sensitive is in large part based upon a study by Alan Steer published in 2008, whereby in order to be included in that study, in that analysis, you had to have two-tiered positivity in order to be included.
And
in
if I understand you correctly, 50% may not. So then
Correct.
you're left up in the air about this.
Correct, and you're dealing with a number of individuals who are very ill, and in fact, there's a component of this that we'll talk about in more detail. There's immune suppression that can occur, and the sicker you are, and this has been published as well, the more likely this antibody immune response will not be shown. So the sicker you are, paradoxically, the more likely you'll be
That's not unique to Lyme.
Well,
In some ways,
No, TB does the same thing.
but let's just get back to this issue of sensitivity and specificity. The question then is what's the gold standard? Because in order to say that a test is good or bad, you need to have a gold standard as to what the disease is.
Right. Unfortunately, the gold standard is not sensitive. The gold standard might be considered a culture. But
Well,
the culture, right,
yes.
that would be the gold standard.
But when you say 50%, what you're saying is that depending upon how you define Lyme disease, only 50% of those people will be positive by test.
Right, but if you're going to use what you perceive as a gold standard of the technology that exists today, the two-tiered system, and claim dogmatically that it is highly sensitive when you're skewing your population by including just those that are positive, then that is
If
not
you're only
accurate.
including people who are positive, then the sensitivity and specificity is 100%.
Right.
But my only point is, and I don't want to argue about what is the gold standard, my only point is, depending upon what you consider to be the gold standard for saying that this group of patients has Lyme disease, the sensitivity and specificity of the assays, assuming they're well done, will be different.
So let's do something else, if I may. Let me refocus just a bit, because the lab testing is contentious, but I think your point's well taken, which is if you say the lab testing is missing this disease, then you have to have at least some other way to define the disease other than the lab, right?
Correct.
So what else do you do to make the diagnosis?
well, this is similar to what happened in the 1960s in psychiatry. We had a phrase, psychoneurosis. Now, different people thought of psychoneurosis in a different way. Then we had the DSM, and the DSM helped better define as a reference point. Now, with infection, you think of PCR, culture, and antigens as proof of infection. Now, the problem with Lyme is it's a microbe that suppresses and evades the immune system. You cannot rely on an immune-based test for an organism that suppresses and evades the immune system.
But we do have, certainly in medical history, plenty of experience in immune suppressive diseases for whom lab tests work. Let's go back to HIV, which is a classic immune suppressant disease for which ELISA and Western blot does work.
It's 500 times more reliable than Lyme disease, based
Okay.
on recent journal article that was published by Cook. So it's, even though it does suppress, that's a better test than what we see with the two-tier testing.
How else would you make the diagnosis? First of all, let's get some basic medicine.
Can I just return to this immunosuppression bit? If Lyme disease, if Borrelia burgdorferi were truly an immunosuppressant organism, then you would and let's assume for a moment that it's the B cell function, it's antibody production, then wouldn't you expect to see these people with more infections, with more...
Not necessarily.
Well,
It could be a subtle degree, well, yes,
but
but
they
to
have
answer
positive blood tests for other diseases.
Not to the degree of HIV, because the degree of immune suppression with HIV is far in excess of, this is a subtle, indolent, infectious process that's been shown to actively suppress.
The problem with this immunosuppressant claim is that HIV is a much better immunosuppressant by destroying T cells, and yet the blood test for HIV is positive.
So that being said, I want to leave that just for a minute. We're going to get back to it.